Hello, how are you? I am the reporter Ana Uritica, and today I'm going to talk about the health system in the country Brazil. Okay, first, how are the sanitary service? Okay, Brazil has mixed healthcare system with both public and private healthcare institutions. The private sector serves individuals who private health insurance or can afford to pay for private healthcare service. Okay, and finally, special care needs are addressed through various healthcare programs. For example, if they need to a public institution or a public or private institution, they need to have various healthcare programs. And it's important to know what are the plans and policies of governmental initiatives related to health system. Brazil healthcare system underwent reform with the creation of SUS in the late 1980, aiming to provide equitable access to health care service. K-State as 2021 healthcare expenditure. Brazil allocated in a significant portion of its budget to healthcare, but disparity and access to quality remain. Life expectancy. Life expectancy in Brazil varied by region, with disparity in healthcare outcome. It's important to take into account each of those points that we touched, but let's know more about health system of the United States. For this, our reporter Julia Ruiz stemmed the information. Hi Julia, how are you today? Okay, let's start.
Hi Anna, it is a pleasure for me to be with you today and share some information about the United States and its healthcare system. The United States is considered a developed country and is one of the world's largest economies. It has a high standard of living, advanced infrastructure, and a well developed industrial and technological sector. But what is its health system like? Public and private institutions. The United States has a complex healthcare system with a mix of public and private institutions. Public institutions include government funded programs like Medicare and Medicaid, while private institutions encompass a wide range of hospital, clinics, and healthcare providers. And how is the administration of health personnel? Healthcare Workers Administration and the US has a significant healthcare workforce, including doctors, nurses, and other healthcare professionals. Administrative roles are critical in managing healthcare facilities and ensuring the efficient delivery of services. Healthcare services in the US cater to various demographic groups. Medicaid serves low-income individuals and families, while Medicare primarily serves elderly population. Private insurance companies cover working-age adults and their independents. There are also initiatives to address special care needs, such as the Children's Health Insurance Program, CHIP, for children from low-income families. And it is important to know what are the plans and policies of governmental initiatives related to health. Government initiated plans and policies. The Affordable Care Act, ACA, also known as Obamacare, has played a significant role in shaping the U.S. healthcare landscape. It aimed to increase access to healthcare by expanding Medicaid, establishing health insurance marketplaces, and implementing regulations to protect consumers. What statistics stand out in the USA health system? Well, um, key statistic: as of 2021, healthcare expenditure, the U.S. spent a high percentage of its GDP on healthcare, making it one of the highest healthcare spenders in the world. Life expectancy. Life expectancy in the US was lower compared to other developed countries. Disease prevalences. Chronic disease like diabetes and obesity were prevalent health issues. Healthcare infrastructure. The US had advanced medical facilities but also faced disparities in healthcare access. And well, in summary, this country is quite complete with respect to its healthcare system. Thank you.
Hi Arna, I'm very happy to be with you today. And well, for me, it is a pleasure to share with you this information about Burundi. Burundi is classified as a least developed country. It is a small, landlocked nation in East Africa with a primarily agrarian economy. So Burundi faces a significant economic and social challenges, including a low GDP per capita and high poverty rate.
What is its health system like?
So Burundi has limited healthcare infrastructure with both public and private facilities. Healthcare services are often basic and face resource constraints. Public healthcare facilities are provided by the government and the international organizations, while private facilities cater to those who can afford them.
How is it health service?
Okay, healthcare services in Burundi are challenged by limited resource. Access to healthcare can be sometimes difficult to those people who cannot allow to pay it, and especially in rural areas. And also, care needs are often under-addressed due to resource limitations.
What are the plans and policies of government related to health?
Well, Burundi has made efforts to improve its healthcare system with assistance from international organizations.
What statistics stand out in the Burundi health system?
Well, the healthcare expenditure Burundi have limited healthcare funding, leading to challenges in service delivery, and life expectancy was relatively low compared to developed countries, and disease prevalence here Burundi face health challenges related to infection, disease, and malnutrition.